Hello, I am Danette Batiste, CEO and Executive Director of Healthy Heart Nation, a nonprofit organization dedicated to eliminating disparities in the Black community through the collaborative expertise of those in health, education, justice, and business. March is Women's History Month, and this is a time to honor women's contributions in American history. And I would like to thank each and every one of the Healthy Heart Nation ambassadors, the women on our team who make things happen, not only for our organization, but for the world. Black women in the United States have made significant strides in health over the last century, yet persistent health disparities remain. These disparities are largely a reflection of inequalities faced by Black women across various social and economic measures. There are several statistics that underscore the urgent need for social and economic equality among Black women to achieve true health equity. Addressing structural inequalities and ensuring access to quality health care are essential steps toward improving Black women's health outcomes across the world. These are some of the reasons why Healthy Heart Nation and the Plantrition Project are so excited to bring the Health Equity and Lifestyle Project Conference to Huntsville, Alabama, March 24th through 26th. Today, I am joined by my distinguished guests, Dr. Shireen Brown Frazier, PhD, RD, and CPT, who serves as a full tenured professor of nutrition and dietetics at Oakwood University, and Dr. Latanya Dixon, PhD, who serves as nutrition and hospitality management at Alabama A&M University. Welcome to the show.
Thank you.
Thank you for having us.
Well, I am so excited, first of all, to be able to talk to both of you, and especially in relation to the HELP conference, which is, coming up less than a week and a half away. I'm so excited. I've been, really focused on this conference for a number of years now, and it is finally coming to fruition. And I'm so grateful to each and every one of you for your role in inspiring the conference as well as putting the word out, to others about the conference. So thank you so much for that. So I want to ask you, Dr. Shireen, as it relates to the conference, what are some of the things that you are most excited about?
Thank you for asking. And first of all, I want to thank you for the opportunity to be here and to share being invited, because this is a wonderful opportunity, especially for what is going to be taking place on March 24th to 26th. Quite honestly, this may sound a little tongue in cheek, but what I'm very excited about is the practical application. While there are going to be, physicians who are headliners who are going to be presenting at the conference, I really am just impressed by the tagline the conference is kind of the first topic. It says where we eat, live, work, play, and pray.
Yes.
Have impact health outcomes. And that for me was really what was very exciting, because yes, what we do with our fork and feet has impact. What we do with our diet and lifestyle has impact, but we are holistic beings. And because this conference is not just looking at only the traditional health indicators, but even areas of faith, and combining our environment, addressing health disparities in a region in the South, that obviously has also some HBCUs that are present, but looking at targeted approaches from non-traditional ways that are actually some of the key answers to some of the health outcomes. So that's one of the first things that really got me excited about the conference. And of course, a little biased, one of the, our nation is we're class of 94. So I'll put that out there. Very proud of my classmate, Clemens, and of course, Miss Oakland, that's another connection there. Of course, personal connections, but from health outcomes, this is really such a timely need, especially when heart disease, as we know, is rampant in our nation, but particularly in Alabama, it's still the leading cause of death in the United States. And when we can look at lifestyle application to address many of these outcomes, I think it's fantastic. And so that's one of the things why I'm very excited that it's going to really looking at addressing health disparities from practical evidence-based data.
Yes. Thank you so much, Dr. Frazier. Okay, so Dr. Dixon, same question. When I reached out to you about the conference, you were so excited about it, and really just dug in and got engaged and got involved. So can you tell us why your response was what it was?
Absolutely. Thank you again for having me to share in the space. And I think Dr. Brown Fraser did an eloquent job of explaining why she's excited about it. I share in her sentiment. And actually, for me, I'm more of a behind the scenes person. So even to be up front talking about this, it's because of my enthusiasm about the conference. It's a worthwhile cause. We know, as you addressed in the intro, that it is Women's History Month, but it's also National Nutrition Month. And so to bring this type of information to a community here in the South, in Huntsville, Alabama, I'm really excited for the city. I'm excited for Huntsville to be able to have so many like-minded professionals all in one space together to share information from an evidence-based standpoint, but also a practical standpoint. And I think so much of what we do in the higher education space in nutrition is not only share the knowledge, but give people a skill set to be able to make the changes after the conference leaves, after we're done performing workshops in the community, that they have something or a starting point to draw off of. And so if that connects them with resources, with physicians in the community, dietitians in the community, cooperative extension, so much of what we do at the Ag Research Station at A&M, I'm looking forward to.
Yes, that is great. And as I was preparing for this talk today, I was looking at the statistics, right? And so if you even just kind of do a Google or, a Copilot or a Chat GPT or anything, and you put in Black women health or Black health as a whole, you get, lots of statistics around, how we're leading in so many of these areas with maternal death rates, diabetes, high blood pressure, you name it, right? But when we were looking at why we decided that Huntsville was a place for this conference, we really did look at the section of Huntsville where you have people who are living well in their 90s and their hundreds, right? And so on the opposite side of those negative statistics, you do have a community that is thriving. Dare we say Blue-Black zones, right? Where they're living well, and they're thriving in those areas. So can you all kind of share with me in terms of like what that means to each and every one of you? I'll start with you, Dr. Fraser.
Sure, I'll dive in. The Black Blue Zone is a real thing. The Blue Zone, it's been, touted by the National Geographic, Loma Linda being a Blue Zone, Sardinia, Italy, as well as Costa Rica and other parts, Japan. There's certain areas where individuals live, to be, non-Nigerians, 90 to 100 years of age. But we're also seeing in the U.S., there was a really cool article written by Dr. DeWitt Williams in the Adventist Review. And I'm going to have to kind of go there with that, because when we talk about Huntsville and not those who live to 90 and the centenarians, there was actually a pretty interesting article that Dr. DeWitt Williams wrote in the Adventist Review that was looking at populations within Huntsville that live, significant numbers that live 200 years. And it's noticed that it was in Huntsville. And they kind of zeroed it a further, it was actually individuals that were within the 35806 or 96 zip code, because zip code is just as important as genetic code, as we're seeing. And so there is some real truth to the Black Blue Zone, and Huntsville being one, probably the only, truthfully, Black Blue Zone where we're seeing this, a high numbers of individuals who live to 90, 100, dare say even over that within this region, and attributing it to a lot of the lifestyle aspects that Heart Nation as well as Plant Nutrition Project actually espouse, and these individuals have been doing it for a couple of decades. And so Black Blue Zone it's a real thing. There's data, and we're actually hoping, not kind of putting it out there, that this conference will ignite the ability to really delve into the whys that we're seeing, and also hopefully encouraging the practices and speaking more about it. And so that's I think the first part I'll say. I'm sure I know Dr. Dixon will probably have some things to share as well, but that's my initial thoughts on Black Blue Zone, that it's a real thing and we are seeing it here in Huntsville.
Yes, yes, Dr. Dixon.
Absolutely. A real thing. Japan, the Okinawans have been studied significantly. You mentioned Loma Linda. We look at the zip code here in Huntsville that Dr. Brown Fraser mentioned, which significantly is surrounding the Oakwood University area. However, if we take it a step further and say, okay, now that we see that that is possible here, what about the gaps? How do we identify those communities that are even near HBCUs like Oakwood or A&M, where there are resources, but there are still a significant amount of people who are not able to access those resources. What can we do?
Right,
And we know
right.
that, one of the things we can do is conferences like this, right? Bring the information to the people in a way that they can receive it and that they can access it. Just the locations of both Oakwood University and A&M, where they're at. They have community gardens, they have marketplaces. So we know that lifestyle is a significant predictor of health outcome. That's no more of an issue in terms of, is it really, significant? We see significance. We see it worldwide and different populations. So now it's about, how do we get people the access to the resources so that they can make those significant differences in their overall health? And so I tend to look at it as half glass empty, half glass full. We can lead behaviors and lifestyles that lead us into poor health, or the reverse is we can change things and have a positive outcome. I'm sorry. And so this type of conversation that we're having, this heart-to-heart conversations about the health conference, is just another way to get people the access to resources so that they can see those changes in their health.
And absolutely, you said, I'm sorry, you referenced like access and awareness, right? Because you have to have the awareness, right? Now that you know, how do you get it? So, it's not always about, okay, what's the what, but you can't leave the what out there by itself, right? You've got to be able to address the how and the what, the why, the how, right? And so these are some of the things that the conference is looking to expand upon. And so Dr. Fraser, Dr. Brown Fraser, I know you were about to say something.
No, it was actually connected to what I was quite excited, to what you were saying. And I always have this passion of, there's knowledge acquisition and then lifestyle application.
Yes.
There's this gap in between where we have this wealth of knowledge, and that's why I think the beauty of the conference being that it's near Oakwood University, near Alabama A&M, Drake State and other universities that are these places of higher learning, and the knowledge is great. But it's also, I think we have a responsibility for the knowledge translation to populations so that can actually be user friendly for everyone. And that's where the public health nutrition comes into play, work with universities, and that's why I'm glad students will be attending, to be able to create that pipeline to translate the knowledge. And sometimes it's not always easy to do that. Making an effective change in large populations is not, we're in the South, and the South intrinsically has a lot of, chronic illnesses that are historic. This is something that happens tonight, talking about the type 2 diabetes, heart disease, cancer, stroke, diabetes, cancer rates. The South has the highest rates in the nation, particularly Alabama, Mississippi, even the highest of the South in many cases. So I believe the conference is going to be not just pushing the needle, but I think will actually create a huge wave. Has the potential to create a huge wave of impact, particularly, physicians, because individuals see their primary care often first, or registered dietitians. And my sense is that that's going to be well represented at this conference. And I'm hoping that there'll be a number of local healthcare providers attending this conference.
Yes, and I am actually going to add to the stage some of the objectives of the conference. And I know that you all are very familiar with them, but I want to share them with the audience as well. And so, some of the objectives of the conference is to understand the disproportionate burden of non-communicable diseases in communities of color, right? And so we're again talking about that awareness piece, but we also want to talk about what can be done to counter those challenges. And, as we had mentioned, especially, I know it's applicable to both of you, is really what you eat. It is a lot of it is nutrition based. We want to be able to understand the relationship, and we've referenced that, between the zip code and the opportunities for health and wealth, right? So if there's something we're doing over in a particular zip code, what do we need to do to translate that to other areas of town to get the same or better outcomes? We have to understand the relationship between food insecurity and lifestyle and chronic disease. We're going to be looking to explore the role and responsibilities of healthcare, businesses, education, places of worship, and on the health in the community. And then we want to learn how to impact change on individual levels. So I know that all of these bullets are important to each and every one of you, but is there one bullet for you, Dr. Dixon, that you're more excited about?
There is. It's food insecurity, because that is the focus of all of my research studies. Just had a graduate student defend food insecurity was her topic. And so the reason why I'm particularly excited about that is because we know that, we've been talking about access and skill set and giving people more than just knowledge to be able to implement those things that we're recommending. But we see a clear line, a correlation between food security status and chronic disease, like the ones that Dr. Fraser mentioned before, right? So know that if we can improve making people have not only access to food, but access to nutrient-dense foods, right? The foods that are going to be supportive for reversing disease or supporting them as they try to overcome disease, then we know that food security is very important. And that relationship between access and utilization of nutrient-dense foods to affect cardiovascular disease, type 2 diabetes, all of our metabolic X syndromes that we're talking about, that becomes very important. And even for, what I love about this conference is that it's involving the university systems at large. So from Cal State to Drake State to Oakwood, and all of the school systems here, one of the things we're studying is food insecurity on college campuses, because that's a real thing. And so as we start to look at, the influence of providing students not only with food, but nutrient-dense choices, can help improve the food security status on campus, which is, for Huntsville, we have a significant number in such a small spaces of universities. I'm particularly excited about that because I see a clear line between this conference and the influence and impact it can have on the city of Huntsville, just from that bullet point alone.
Yes. And how about you, Dr. Brown Fraser? Which one did you want to highlight?
Honestly, it's a tie, a strong tie between, of course, because March being National Nutrition Month, being a registered dietitian, amongst other hats, understanding the relationship between food insecurity, lifestyle, and chronic disease. But it's also a tie with understand the disproportionate burden of non-communicable diseases in the communities of color. I get tired of the data.
Yes.
I mean, that's just, it breaks my heart when I consistently see, I look at the map of the United States that the CDC puts out. And when you look at just the rates of the non-communicable diseases, for example, type 2 diabetes, hypertension, stroke, and you look from like the 80s and you kind of look each year and the color changes throughout the United States as far as the rates of these non-communicable diseases. And you see them consistently highest in the South for almost a 30-year decade. And then some parts of the West Coast, you don't really see changing much. But the disproportionate effect to individuals of color is so powerfully high, independent of socioeconomic status. So one would think, well, if you become higher educated, which does play a role, if you have a higher salary, well, maybe it's going to be protective. We're seeing when you compare, individuals who have the same salaries of different races, whites to black, we still are at higher risk of these chronic diseases. And some of it is systematic. Some of it is because we don't understand the full relationship between food and chronic disease development. We think we do, but the real, nutrition is such an underrepresented, unsung hero to the prevention module, which is why this conference is so powerful, because it's now not anecdotal. It's not saying, well, what I think or what I believe or what I may have heard. It's creating a platform where our healthcare leaders are saying, this is why what we do with our fork and feet, giving as basic as we can with data, to how it can reduce the risk so that you can walk your child down the aisle, so that you can see your grandchild, because we all have to, we all will leave this earth one day, but it's a matter of, can we live long enough to have the quality of life that's long enough to ensure that you will be able to have those moments. And so because the disproportionate burden of these non-communicable diseases are such at higher rates of the Black and Browns, it's taking us out sooner. The diseases
Yes.
are heavier, they hit us harder, and they take us out sooner. And
Mhm.
so I believe the conference will allow fully such a ripple effect to start
Yes.
the important conversations, the necessary
Mhm.
conversations, even with some of the policymakers in public
Mhm.
health that in the
Yes.
state of Alabama, because traditionally, food is seen more so, in my understanding, as something that is, we don't want to kind of talk about, don't touch my, plate, or don't, I don't have time exercising, and everyone's busy. And this is not to criticize it. It's really a
Right.
construct or a
Mhm.
platform that, it's that we live in a stressful world, and
Yes.
everybody has so many things that is going on in their lives. And if we can provide some life jacket, so to speak, i.e. this conference, to be able to give tools and to say, hey, here are some solutions that can help.
Yes.
Um, I believe it has context to those two bullets that I shared.
That's fantastic. Yes,
Yeah.
I agree. And so, one of the other things that we're extremely excited about is, we are going to be able to provide 15 CMEs, CEUs to those who are in attendance in a variety of different areas. Because time is money, right? But the reinvestment of your time into yourselves, is something that should be rewarded. And so we were able to get those secured. We talked about, the involvement of both Oakwood and A&M in this conference. We're looking at it as a mini HBCU reunion, right? Because a lot of times, especially for health professionals, they're attending conferences in a lot of instances. And sometimes it's very challenging to find people who not only look like you on the stage, but also look like you in the audience. And so we're pretty confident that that is not going to be the case as it relates to this conference. But this conference isn't just for certain people, it is for everyone. But we want to make sure that the representation is there. You'll have the opportunity to network. And as you all discussed, it is really about that problem solving piece. And that piece happens after the people on the stage have a chance to say what they needed to say, right? So when they come off, they're going to be able to, you all will be able to reach out to them and say, did you think about this? Have you talked about this? And so all of those collaborations and those networks are going to be able to happen as a result of attending this conference. The design of the conference is not like you're just going to be lectured to, for hours and hours at end. What it is going to be is a mix of TED Talk style lectures, where you're going to have that. Then you're going to also be joined by expert panel discussions. And then you're going to have a real riveting Q&A session from people in the audience, because again, those are the people who will be in attendance, who are passionate, who have perspectives to share about these important things. So the location of the conference is going to be at the Huntsville Marriott and Space and Rocket Center. Again, as we talked about, it is located, we said, near 3 historical Black colleges and universities: Oakland University, Alabama A&M, and Drake State. And we also have the engagement of the University of Alabama in Huntsville, and we also have Calhoun Community College. So we've got all 5 of the universities in the Huntsville area, not only, providing representation to the conference, but they are also joining our panels. And so our day 1 is going to be an evening launch. It's dinner with an opening lecture from Dr. Scott Stoll, as well as Dr. Columbus Batiste. And we have some greetings that we're going to be receiving from some local officials. So we talked about the public policy piece. It is really about engaging the community as a whole. And so you can't have one without the other. Our day 2 is really to look at the state of African American health. We'll be talking about maternal and child health, cardiovascular disease, diabetes, and we're also going to be looking at mental health, especially in the areas of Alzheimer's. So it's very important that we look at these things from a collective and not just individually. And then our day 3 is really about what is the answer, right? And so we're going to be looking at hospital systems, places of business, places of faith, as well as the education system. And then we're going to have a nice plant-based lunch, right? And that's also something that you're going to get at each of these meals. You're going to get the kind of nutrition that is going to fuel you, fuel your body and your mind. So as you are continuing to experience the conference, you have the intellectual capacity to take it all in. And so each of the sessions, it will be accompanied by plant-based meals. So again, the conference is taking place. It starts Sunday, March 24th. It ends March 26th. Here is a barcode. Here is a scan. If you are not already registered, there's still some tickets available. You can go to thehelpconference.com or .org, either one of them, and you can still get registered to attend and join this conference. And so, with that, I am excited. I am looking forward to seeing each of you ladies at that time. I will be hugging you, so get ready for this big hug I'm going to give you, because I am just so grateful for everything that you all have done to make my job out here in California a lot easier to get this word out in Huntsville. But before we close, I would like to allow you each to have, some closing words as it relates to the conference. And I'll start with you, Dr. Dixon, this time.
Well, closing words for me, I just want to say I am excited for the city of Huntsville. I'm excited to meet with like-minded individuals in this type of setting, in this space. I am excited that all the way from California, this has been planned with our community in mind. So I just think it'll be a wonderful opportunity for those of us in the higher education space, for those of us who are in the hospital systems, for those in the community, to all come together with the same purpose in mind, to learn from each other, share with one another, and to expose our students who, in higher education, we are preparing the next generation of future leaders. So, we have the opportunity to put them in a space to see how this type of community-centered work takes place in a real world setting and action. So I'm excited for my students. I'm excited for the city of Huntsville, and I'm excited to see you all.
Thank you. Dr. Brown Frazier?
Dr. Dixon said it all, but I will add, I thought she just said it beautifully. This conference, I believe, is going to be a premier collaborative event, premier collaborative conference to address some of the most important and significant health outcomes that is needed in the state of Alabama. Let's just say worldwide, but because it's going to be in Huntsville, we're targeting. It is going to be, I believe, the beginning of some great collaborative efforts that's going to address health disparities in ways that I don't think have been addressed thus far. Yes. And so I'm looking forward to it. It's going to be exciting. I believe that this is just the beginning. I don't think we really know what's the exceptional outcomes that are going to come from this conference. This is just the beginning. So I'm very excited again, also for the city, for our schools, for faith, for so many individuals that I believe will have positive impacts from the conference. So I'm excited. I'm looking forward to it.
Well, thank you very much. And we are so grateful again. And so just wanted to again thank you for listening to our heart-to-heart discussion today. And we will be back next month. Every third Friday, we have a heart-to-heart session. So Friday, April 19th will be our next session. Please like, subscribe, and share. And so for that, we are very grateful. Please follow us on YouTube, LinkedIn, Facebook, and Instagram. That's where you can find us and other relevant topics. And so again, we appreciate your time. We thank you, and we hope you have a fantastic day or night.